Alright, hello everyone. For those of you that don't know me, my name is Mark Gartner and I'm currently a junior here at Liberty University. And today I will talk to you about the trachea and the esophagus. Now both of these organs complete different jobs but still use a common pathway, the pharynx. First I'm going to start out talking about the anatomy of both these organs, some of the physiology, and then I'm going to conclude the conversation with a discussion about a few of the common pathologies that go with these organs, starting with the trachea. Right, now the trachea is the primary conducting organ of the respiratory tract from the larynx to the carina, which isn't shown on this model, but it's basically the point at where the primary bronchioles separate off from the trachea. Now there's three different points on the trachea that I'm going to cover real quick. There are the C-shaped tracheal cartilages that you can see that wrap around in bands. And then there's the smooth muscle band along the back, known as the trachealis muscle. And then on the interior side of the trachea, there's the respiratory epithelium. Now, there are three primary different types of tracheal cartilage. There's the middle cartilages, which are known as the normal or so cartilages. They're any cartilage from the carina to the first cartilage. They're about 4 millimeters thick and about 1 millimeter thick interiorly. Now the first cartilage is known as the peculiar cartilage, and that's because it's a lot broader than the other middle cartilages. It's about 6 millimeters usually and about 2 millimeters thick interiorly. Now the carina, or also known as the last cartilage, is a triangle-shaped form of cartilage that sadly we don't have on this, but basically it's where the primary bronchioles separate, and so you'll see it's quite pyramid-shaped. Now on the back you'll see the trachealis muscle. The primary function actually of this muscle is to constrict the trachea to give moving air more force in modes like coughing or trying to get extra material out of your respiratory tract. Now, the epithelial tissues that are inside the trachea, their whole job is to get mucus or particulate matter outside as well. And we'll be talking about that during the physiology portion of this. As I mentioned before, the trachea does lie anterior to the esophagus, and you can see a really good view of the anatomy of both of these actually from this view. You can see how the esophagus is actually flattened behind the trachea and how the trachea is kept open by these C-shaped tracheal cartilages. As mentioned before, there's three different parts to the trachea. There's the C-shaped tracheal cartilage, then there's the trachealis muscle, and then you can see this dark band going the whole way around the lumen is known as the respiratory epithelium tissue. Now, you can't really see it from this view, but there are two different parts, major parts at least, of the respiratory epithelium, which we can see from this view right here. So, from here, you can see the two different parts. You can see the ciliated columnar cells right there. You see the cilia band going all the way across the top of that. This, by the way, is the lumen in here of the trachea. And then you can see these goblet cells, which the purpose of those is to secrete mucus. Now, the whole purpose of this cell setup is to remove particulate matter from the airways. Basically, the mucus secreted by these goblet cells catches all the dust from the air and gets clumped up against the wall of the trachea, and these cilia kind of sweep it up and out of the airways. And this can be done by just the sweeping or by coughing too. This diagram kind of shows you the relationship between the trachea and the esophagus. You can see right here, this is the split junction where the esophagus kind of runs off the pharynx and the trachea runs off the larynx. You can see right now that the esophagus lies posterior to the trachea, and the esophagus actually is just a flattened muscular tube that has three different layers. There's the mucosa, which is the innermost layer, the submucosa, the middle layer, and the muscular layer as the exterior layer. The muscular layer is also called the muscularis propria and is composed both of striated muscular tissue and smooth muscle tissue. The upper portion, closer to the pharynx, is known mostly to be composed of striated tissue, and the lower portion, closer to the stomach, is made of smooth tissue, with the middle kind of being a mixture of both. Now, there are 4 different constrictions in the esophagus. There's the first constriction, which is up when the esophagus first splits off the pharynx. There's a constriction in the esophagus from when the aorta arches around and moves down into the abdominal cavity. That arch creates an impression onto the esophagus. There's also a constriction called the hiatal impression, which is where the esophagus moves through the diaphragm and attaches to the stomach. There's a constriction there, and that's also known as the gastroesophageal sphincter, or at least most scientists believe that the sphincter doesn't really exist and that it's just the diaphragm pressing into the esophagus that stops food from going down. And also, there's a constriction where the left bronchus comes down and impresses itself into the esophagus. From this cross-sectional view, we can see the 3 divisions of the esophagus quite easily. The mucosa, the innermost layer of the esophagus, is the dark band with the zigzag pattern of lines, also called papilla. The submucosa is this lighter strip of tissue straight through the middle of the diagram, and the muscularis propria can be seen to the far left. The cool thing about the esophagus is that it does undergo peristaltic contractions, which allow food to move more quickly down the tube. The other cool thing about this is that you can literally swallow while hanging upside down. Alright, now I'm going to talk to you guys about a few of the common pathologies of the trachea. There are 3 primary ones. There are tracheal tumors, then there's stenosis of the trachea, and also tracheobronchi malacia. Starting with tumors. Tumors are either benign or malignant, and they all usually have mostly the same symptoms, which includes difficulty breathing, wheezing, stridor, which is a high-pitched musical sound that occurs when breathing in, and hemoptysis, which is coughing blood. There are 3 primary forms that you'll see, and the most common of which is squamous cell carcinoma. There's also adenoid carcinomas, papillomas, and carcicoid tumors. The next is tracheal stenosis. So stenosis we know is the hardening of. The tracheal stenosis, however, is a constriction of the trachea. So if you were to see a stenosis of this trachea, in between one of these cartilages, you'll see it very, very, very heavily pinched off. And the symptoms of these are actually very similar to tumor, and that is difficulty breathing, hemoptysis, stridor, wheezing, or even it's common to have infections like pneumonia or bronchitis with something like this. It's also mistaken sometimes as late onset asthma for patients, and one of the biggest causes of it is actually an injury from prolonged intubation, which is a procedure done to keep you breathing while you're in surgery. So the third is tracheobronchi malacia, which is basically a partial or complete collapse of a respiratory area. So you'll see a bronchus that has been malaced will be partially or completely just closed off. And this can occur similarly to the stenosis. It can occur if there's damage done to the respiratory tract from intubation. It can also occur from frequent respiratory infections such as pneumonia or bronchitis. And actually a symptom of tracheobronchial malacia is recurrent or chronic infections of pneumonia. And other symptoms are difficulty breathing, wheezing, and hemoptysis or coughing blood. Alright, now I'm going to move on to the pathologies of the esophagus. 3 primary ones I'm going to talk to you today are achalasia, GERD, and Barrett's esophagus. Achalasia is a swallowing disorder that is caused by the miscontractions of the diaphragm or the gastroesophageal sphincter. Now, these not relaxing does not permit food to enter the stomach, and so patients that have achalasia can have food sitting in their esophagus for hours, and that can cause lots of damage by itself. Common symptoms of achalasia are choking, regurgitation, and dysphagia, which is difficulty swallowing. The next pathology is GERD, or gastroesophageal reflux disease. Not to be confused with common heartburn, gastroesophageal reflux disease is a chronic condition where the acidic contents of the stomach reflux into the esophagus, and this causes a high quantity of acidic burns onto the mucosa and the submucosa, and this can cause lots of damage and a lot of other pathologies, one of which actually is Barrett's esophagus, which I'll be talking about later. Now, GERD is actually quite a common disease. 1 in 5 Americans either have and haven't been diagnosed yet with GERD or have been diagnosed. But it is actually a disease that can be treated quite easily by medication or even small, minimally invasive endoscopic surgeries. So, moving on to Barrett's esophagus. Barrett's esophagus is a condition that's a result of GERD, and it actually is quite devastating to the esophagus in the fact that it alters the anatomy of the esophagus in a way that's very difficult to repair without causing a lot of extra damage. So basically, Barrett's esophagus is a condition where the mucosa and the submucosa gets converted into goblet cells that secrete mucus that are similar to the stomach. Now, that might sound like a good thing. It neutralizes the acids that come into the esophagus as a result of GERD, but that's actually a very bad thing, and it can lead to cancers of the esophagus, which can be very, very fatal. Now, there aren't too many treatments other than surgical options for Barrett's esophagus, and that's exactly what makes it a very, very dangerous condition. The symptoms of Barrett's esophagus are frequent onset heartburn, hematemesis, which is actually the vomiting of blood, and dysphagia, as mentioned before, is difficulty swallowing. Alright, so earlier I talked to you guys about the anatomy, physiology, and common pathologies of both the trachea and the esophagus. To kind of segue out of this conversation, earlier this week I actually read a verse, Romans 14:8, and it says something a little like this: "For if we live, it's to honor God, but also if we die, it is also to honor God." So whether we live or we die, it is all for the glory of the Lord, and we belong to Him. And what we can take out of this, especially us as biology students studying God's creation, in particular anatomy, God's creation of our own bodies in His image, we can take that as living in the physical world, we tend to focus only on what we can see, feel, hear, taste, and such. But there's a lot more to life than just what we have here on earth. But there's a whole spiritual universe and a whole spiritual life that are ahead of us after we die. And so that's just kind of a thought to not just focus on the physical, but also what God has for us for the rest of our lives, even past when we die sooner or later. Well, thank you guys for watching. I hope you guys